Hi guys, so this is part 2 of the BPD diaries and what it's like to be BPD. So as I mentioned in the last video, part 1, which I will post a link to at the end of the video, I was going to talk about distress tolerance today. Okay, so distress tolerance basically is what it says it is. It's tolerating distress. Like, I'll use an example. For an ordinary person who's not borderline, say their boyfriend breaks up with them, and that causes distress. So how they handle it or react or react and respond and is usually not so out of control. It's very, you get it out, so to speak. Cry, confide in friends, eat ice cream. I don't know, like things like that. Now, if that were to happen to someone with borderline personality disorder, that's not exactly what would happen. We tend to cling to people, which is another topic for another video, but for the example, so there's a book for borderline personality disorder called I Hate You, Don't Leave Me. So I don't know, like, it's what things we do is we do things for attention, like cut ourselves and then make sure that the boy knows that's what we did, and some people do suicide gestures. And sorry, I can't talk, guys. I really have a sore throat. And yeah, and just really intense things. Like, I think I mentioned it before, but like very black and white thinking pattern. Like I said, the emotions are very black and white, up or down. So I have a cool boyfriend, I'm gonna kill myself, he dumped me. So that's the distress. Or little things even. My show's not on. So you're right there, not like not stable, but like, oh, I'm gonna watch my favorite show, and then it's not on. You don't probably don't go as low as suicidal, but you get depressed for something silly. But and our triggers, we all have them. Everyone's different. But for me, it's 2 female celebrities in the world. I'm not going to mention who they are. And when their names are brought up, I get triggered and I resort to bad behaviors. I try not to, and sometimes I don't, but sometimes I do. And it's not very productive, but and the things I'm a self-harmer. Some people, like I said in the last video, alcohol, drugs, eating disorders. For me, it's cutting. So that's my coping mechanism. I wouldn't call it a coping skill because it's not a skill, it's just a way of coping. And it's negative, so you know, you jump to the extreme. You don't call your friend first, you don't call the crisis line first, you go right to the bathroom and cut yourself. Like, whereas if you called your mom or dad or a friend or whoever, you might not feel so bad, and then, well, we don't think that. Like, it's black and white. We don't think that. We just go right to the extreme. We don't exactly have a pause button. So, but that can be learned. I attended a skills group, and that it's DBT, dialectical behavior therapy, and it teaches you basically skills, and it's based for borderlines, but anybody can get anything out of this. And it's based for borderlines, but and it teaches you skills in each area of each problem area of borderline. So yeah, so I'll end this now, and the next part will be about interpersonal relationships. Okay, guys. My mouse is dumb right now. Bye.